Women's health research at Yale has a training program that's called Building Interdisciplinary Research Careers in Women's Health. And the focus of this program is to train the next generation of researchers on how to conduct team science in order to increase their capacity to move forward in their research careers and to engage in team science. So women's health research at Yale is really a national leader in being able to train these junior investigators in how to conduct research that takes a more expansive focus than their careers have taken previously. So it kind of takes them out of their comfort zone and trains them on how to engage researchers in other disciplines, to be able to start to collaborate, to put together teams of scientists to address questions that they're interested in pursuing.
Women's health research at Yale has provided me as a junior faculty member with a community of scholars and kindred spirits, so to speak. So it's really provided me with support, not only specific to my research in terms of mentorship and expertise during the perinatal period in psychiatry, but it's also provided a community of colleagues where I can ask questions about career development and also find support in general around this area of work, the importance of women's health research.
So your research needs to have real-world significance, that you need to be able to identify the work you do and how it's ultimately going to be related to the treatment of disease. And this has had a large impact on how I mentor trainees in my own laboratory now, how I help them consider long-range plans for their own careers, and also always stress the practical benefit of their own research.
One of the most exciting things about being a researcher and a teacher at a university is that you get to introduce young people to research. And I've had the good fortune of supervising dozens of PhD students in my laboratory. Many of them, over half of them, were women. And it's particularly, I think, exciting to those women to be able not only to learn about this new field of biomedical engineering and how one might use it in health, but to think about how it can be used to improve the health of women.
We are only at the beginning of what we need to know about women's health and gender differences, and so it's clear to us that we need to train a next generation of researchers who will focus on the area of women's health. And we are so pleased to have young scientists come to us to study as junior faculty, as postdoctoral students, as undergraduates. And we have many people interested in doing that. And it's really been our great pleasure to integrate them into our program.